Welcome to Are You Ready? Essential Disaster Health Information Resources for You and Your Loved Ones. My name is Brian Leaf, and I'm with the NNLM South Central Region. Just a little bit about the South Central region. I know many people are already familiar with us, but we're just one of 8 program offices around the United States. And we aim to advance the progress of medicine and improve public health through increased access to health information within the states of Arkansas, Louisiana, New Mexico, Oklahoma, and Texas. So if you reside in one of those states, come check us out at some point, check out our services. We offer disaster preparedness funding, and our funding applications are open now. So as I said, we're one of 8 regional medical libraries, also called RMLs. You'll often hear us say that. We're number 5 down here, but please check out what other offices are out there and which one you belong to if you're not within our region, to see what sort of services and funding that they might provide. So we've done a lot here in SCR. In terms of our service offerings. And, I like to mention these just to give people ideas about what kind of program that they might want to do. This image is from our local chapter of the Medical Library Association. I coordinated with a local organization to offer Stop the Bleed training to many of the participants. We also offer webinars every month or every other month. And a couple years ago, we had Bill Eisnagel, the Director for Emergency Management at Women's Hospital in Baton Rouge, talk about emergency management. So we always try to touch on disaster topics here and there. And then, as I mentioned, we have disaster funding available, and right now we have a Disaster Preparedness and Recovery Award of up to $15,000. So this is just a quick look at some of our services. Some people wonder, I present at a variety of conferences, and people wonder, well, why libraries, and why are they involved in disaster management? In 2011, they were recognized, libraries in general and a lot of other sort of cultural and community organizations were recognized by FEMA as being eligible for temporary relocation funding. They were essential resource, after disaster events in the United States. And they've always made themselves available as shelters, even during turbulent times. If you remember the protests in Ferguson, Missouri a few years ago, the library stayed open and the director was able to rally the community to provide a safe space to children when schools were closed. During hurricanes, evacuees have gone to libraries or pop-up libraries for help with internet searches for relatives. FEMA forms, community services, and information about the flood statuses of their neighborhoods when their own accesses to resources were compromised were available. Bilingual staff help translate signage, and technologically savvy workers entered evacuees into a statewide database, and youth librarians have helped to entertain frightened children. So the libraries, are a key resource and partner in a lot of different types of events, including disasters. You may or may not be aware of this, but the Medical Library Association and National Library of Medicine have also joined together to offer a disaster information specialization program. This program is available for anyone who plays a role in health-related disaster preparedness, response, and recovery. So you can see this list here, and I have a couple of links down at the bottom there. Again, if you want a copy of the slides, I think I saw something in the chat box about how the link wasn't working. So I'll try to see what's going on there. And let's see, this link seems to work for me. Okay, I just got a chat saying that's working now. So some of the links we'll put into the chat box, but if not, they will be available and more on our slides, and you can always email us to get those later. Okay, so the presentation outcomes. With my presentation today, I'm going to describe some of the basic terminology, concepts, and ideas around disaster management. This won't be new to everyone, but I always think it's good to have an idea of sort of what sort of the terminology is used in conversations around disaster preparedness and disaster management. You know, it's not too difficult. So just a few slides on that. Here I have described factors that impact different audiences. I'm not really going to focus too much on a lot of different audiences. Today I'm going to focus on sort of an older adult audience, and it will give you an idea of the types of things that you might think about when you're trying to think about any sort of given target population as you think about doing research into disaster preparedness or doing programming around disaster preparedness. And I think I said earlier, I hope we can brainstorm a little programming and potential interventions to better educate and prepare older adults, or really any adult population, for disaster response. And then, of course, identify NLM databases and other resources or applications that can help provide disaster health information to older adults, or really, like I said, any population during all parts of the disaster cycle. So sort of just general information. When we talk about disaster management, it's broken up usually into 3 or 4 phases. If you do any sort of searching around it, or you've looked into disaster management, you'll usually at least see preparedness, response, and recovery. But sometimes you'll see mitigation included, but you'll also see a lot of charts where there's even more than that there. We're not going to do a deep dive into what defines each of these things, but mitigation typically refers to what's done to prevent an emergency or reduce damage. So this is anything from improving the foundation of your home or business to buying insurance. Preparedness refers to the plans that are made before an emergency to better respond to disasters. So this might be stocking food and water, or doing regular fire drills in your home or business, or other types of drills in which you might meet at a rendezvous spot in or outside of the home or business. Response is the actual implementation of these plans. So executing whatever strategy or plans that you had made during your preparedness phase, and then addressing other essential needs during an emergency. This could be seeking shelter, turning off gas valves, any immediate need to help you deal. And then finally, recovery, the phase after disasters, is about trying to both restore normalcy and mitigate the effects of future disasters. It's never about trying to get back to the way things were before, because things are always different after an emergency. So these phases are often blended into a cycle where preparedness is sort of the biggest chunk of the pie. And sometimes recovery and mitigation is also seen as a big chunk of the pie. The recovery from any given disaster can take years. And then when we talk about disasters, we're talking about a wide range of events. Extreme weather events like Hurricane Harvey and Irma were on most people's minds a couple of years ago. You know, but it can include any type of event that results in severe loss, whether it's a force of nature, accidental or man-made, such as a cyber attack on a hospital. The Suburban Emergency Management Project defines all of these events as all hazards. So that's a term that you'll often hear. And these are events that are somewhat widespread and intense enough to overwhelm affected areas to the extent that they need external intervention. Can send victims fleeing to distant localities, forcing communities to quickly accommodate and relate to large unfamiliar groups. So basically, an event that overwhelms the ability of local communities and local authorities to take care of it themselves. It's usually how disaster is defined, and the umbrella concept for all of these types of disasters is all hazards. And then, like I said, we have a couple diagrams here for the disaster management cycle. So you see a very basic one here on the left. As I said, preparedness is considered, or ideally considered, as, you know, a big chunk of time and effort. Response is a short period of time. And recovery here, it's only taking about a quarter of the pie, but that can also take a pretty long time. And then there's the term disaster health information. But I think an important term to define is this. I especially like to define this term when I'm talking with emergency management folks. Disaster health information is the evidence base that informs disaster management activities that relate to human health. So for medical librarians, the idea of evidence-based practice is not really new, but I guess a couple of years ago when I was going to emergency management conferences, I would hear a lot about how you know, while teams, emergency management teams, you know, have very good structures and organizations put together and are very good at responding to disaster events. You know, being able to have more real-time information, have a greater evidence base to draw from is very important. There's scholarly literature such as journal articles and books that are likely to have case studies and in-depth information. And then there's a large and constantly growing amount with disaster health information of what some of you may know as gray literature. So gray literature is a lot of the reports, case studies, lessons learned, documents, procedural guides, local data regarding hazards, reference guides, and you can find these in from a lot of these sources: CDC, FEMA, Disaster Lit, which I'll talk about a little later. There are just a ton of resources out there. And then when we talk about scholarly literature, I'm not going to be able to go over all those resources up there, but PubMed, HasLib or HasLib, I'm not actually sure how most people pronounce that, the NCBI bookshelf. So a lot of these resources I would encourage you to check out later in the slides. While local, state, and federal organizations have built an infrastructure that is intended to help deal with emergencies, like I said, there are lots of great teams, lots of great emergency coordinators out there. Preparedness really begins with the individual. Your institutions might have plans for continuing operations and mitigating loss for the business or organization. But realistically speaking, you're not going to be able to fulfill those duties if you're worried about family members and don't have your own plan in place. For instance, if you can't charge your phone and don't have ready internet access, do you know how to contact your family members or loved ones. You have a meeting place, a rendezvous place, in case communications go down. What about your pets or your medication or your pet's medication? After disaster strikes, resources and the ability to acquire resources can become scarce or impossible when stores close, if roads become inaccessible, and communication becomes hindered. But we know enough about disasters and their effects to be able to develop plans for how we can respond. And things like making sure we have essential documents and account passwords, emergency supplies, and a designated meeting area for our families or even our friends. Who do you want to be with when disaster strikes? These are at least a few things you might want to think about or have your constituents think about moving forward. Sort of the good news, though, in sort of the most recent FEMA National Household Survey, there's a shift from people who are just thinking about being prepared to actually being prepared. And so I included some of these stats here. 57% of adults have pursued 3 or more of these preparedness actions that you see here, attending a local meeting, even having the conversation with someone about how you might be prepared. And then you can also see here a breakdown of the percentage of adults having a specific dollar amount or range saved in case of an emergency. The stat that the actual FEMA report pulled out, if you read that, is about most people have at least $500, saved up, which at the end of the day might not be enough, but this isn't about making a judgment call on these things. I'm just pointing out the information. And then it's difficult not to talk about health literacy in sort of any context. So this is a slide that I show in many of the presentations I do, not just disaster management, but health literacy in the United States is a bit dismal. These stats are from 1995, but it's still cited by recent speakers that at least our office has hosted within the past couple of years. But more recent research has also still pointed to similar literacy issues today, even with the internet. And it's not just health literacy. General literacy is not great. And if you're trying to deal with a high-pressure situation such as disaster, you end up with a perfect storm of issues with not just trying to respond, but trying to communicate. Just a little bit more about health literacy and, sort of health literacy in the digital age. There are a lot of articles out there that talk about people's general inability on average to find the information they're looking for. It's not great for health information in general. It's probably not going to be great for disaster health information. And that all really brings us to our first resource that many of you may already be familiar with. Medline Plus is trusted health information for you and your families. Medline Plus is the National Library of Medicine's flagship sort of consumer health resource. It has over 1,000 topics, health topics, that have curated resources on their own. I pretty much use Medline Plus for everything now. Whenever I have any sort of issue, I tend to get injured a lot because of the activities I do. I always enter into Google Medline Plus as a keyword, and then whatever I'm looking for as a keyword. And then inadvertently, you will find something on Medline Plus. It's also written at a 6th to 8th grade level. So in terms of literacy, it's a very easy to read resource. It's in multiple languages. And they have, oh, sorry, I thought this was a different slide. I guess we're going to take a quick poll actually right now. So I said earlier about how we're going to think about sort of different target populations, but as an example, just really focus on older adults. So according to an American Community Survey report that the Census Bureau released in 2018, what was the most prevalent disability for all older population age groups? Just go ahead and enter what you think that is into the chat box. Chat box is not recorded, but you can also send things to me privately if you want. Thanks. I'm getting a flurry of answers for people. While all of these things impact older adults, the most prevalent disability is walking and climbing stairs. And you can put it into the chat box if you want, but why do you think that some of these are going to be an issue? Why would we talk about this during a presentation on disaster preparedness or disaster management? It's not a hard leap to think that if you're trying to respond to a disaster and say an alarm goes off, but you don't hear very well, that's a problem for me personally, actually. As a musician, I have a lot of hearing difficulties sometimes. Just looking at the chat, yeah, and if you can't hear or you can't make out certain sounds or frequencies, depending on who's talking, you might not be able to understand directions or understand what's coming into the loudspeaker. Having trouble evacuating, power outages, and it's not just, of course, there's more than one target population that suffers from maybe mobility issues. You know, women who might be pregnant. Children, young children might not be able to navigate. So really thinking about physical functional issues that people might have as you're thinking about doing disaster programming is really important. But yeah, lots of good points there. Medline Plus, this is actually what I expected the next slide to be, sorry. Medline Plus has topics on a wide range of issues, including disaster preparation and recovery. This is sort of what each of the topic pages look like. If you were to scroll down a little bit, you'd see a lot of vetted resources, and that's what I really like about Medline Plus. It gives you basic information on whatever topic you're looking for, but then it also gives you a lot of information on the topic from other vetted institutions, and these resources are manually curated, and they have resources not just for consumers, but if you're trying to do research, you want to see clinical trials or journal articles, you're trying to look for an expert, or perhaps you're looking for the same information that is in a different language. Medline Plus has a lot of this. This one just happens to have a link on older adults. Another resource is PubMed. Many of you may already be familiar with this. It's a freely available database with over 29 million vetted citations. There's an expert committee that vets these journals. And what you may not know is that PubMed actually contains thousands of journal citations on disaster and emergency topics, including natural disasters, bioterrorism, chemical terrorism, and pandemic infectious diseases. So go check this out at some point. Please note that citations in PubMed are free, but full-text articles sometimes require payment to access. There's a related resource I don't have here also. I know many of you may be noticing that I do have the old PubMed screenshot here, and there's a new interface that's already available. But a related resource, PubMed Central, as I mentioned, is an archive of free full-text journal articles, which also does include disaster health information. So again, just learning more about older adult population, that actually tends to be one of my liaison responsibilities, which is why this presentation it does have a little bit of a focus on older adults. But if that's not something you have a bead on, you know, it's a huge trending topic right now, is that, you know, due to modern medicine and other factors, we just have an aging population. For the first time in the United States, actually this year we are predicted to have more people over the age of 60 than people under the age of 3. I think in a few more years it's supposed to be more people over the age of 60 than under the age of 18, and that will be milestones in human history. And so we're all going to get there. So think about emergency management and thinking about a disaster preparedness in these terms, I think is really important. We already talked a little about functional issues that older adults have. Here are a few more potential cognitive and physical issues. But it's not just, again, it's not just older adults who have these. And a lot of these stats, you know, there's probably something comparable, or there's an equivalent slide or statistic about other types of populations out there as well. Something So here's that list of potential cognitive and physical issues. Just going to gloss over this a little bit. When I think about emergency preparedness, I also think about physical fitness. So again, this next resource is from the National Institute of Aging. This is Go for Life. This is an exercise campaign that actually has a lot of great resources. It goes into different videos that show you how to do particular movements. There are also a lot of demo videos on their YouTube channel. There are a lot of resources for just even getting started with exercise or fitness. It says that it's designed for adults, I believe age 50 or 55 and up. But I think this is just a great resource for anyone. It really does bring in motivations that I think applies across age spans for why it might be important to engage in physical exercise. And again, I think about trying to struggle during a disaster. You may need to be able to help yourself or help others, and you know, having a certain level of fitness can definitely help you or your clients do these things. Like I mentioned, they have YouTube videos that demonstrate exercises. I really hope that these bookshelves are really sturdy. I kind of picked out this video because I just thought it was funny, because we know that libraries don't really look like this anymore, or at least not all libraries look like this anymore. And I'm pretty sure there are better walls that you could do wall push-ups on. I also like talking about older adults because they can be a ready sort of volunteer force. During the British Columbia wildfires, according to the World Health Organization, they really formed the backbone of community emergency response. You know, being able to help their immediate family, being able to use skills developed over a lifetime to provide information, advice, and technical skills during recovery. And you can see in the Chernobyl power plant accident and during Cuba hurricanes. I know this is a little bit of an older report here, but they've been essential as sort of a resource for the community when it comes to disaster preparedness. So earlier I mentioned gray literature. So one resource that comes out of the National Library of Medicine is Disaster Lit. And Disaster Lit, you can read the description here later, but it's an important tool for finding even more focused gray literature on disaster health topics. This database contains English language materials from non-commercial sources, and it really supplements what you can find off of PubMed and Medline Plus. So you'll be able to find resources such as expert guidelines, research reports, conference proceedings, training materials, fact sheets and websites, and it draws from more than 1,400 associations, government agents, and NGOs, non-government organizations. So again, this is just sort of an example. I'm using that terminology, that term I defined earlier, all hazards. I just put it with older adults, and you can see a couple of resources that pop up here. I encourage you to go ahead and play with this resource if you get a chance. If we were to click on this resource, it would take us to a CDC resource. Again, all these resources and disaster lit and some of these other guides we see here, Medline Plus, they point to authoritative resources. Okay, Disaster Information Management Research Center, DIMRIC. DIMRIC is basically your one-stop shop. It's a portal to training, news, research, literature, and lots of resources from government and non-government agencies. It got a facelift a couple of years ago, if you've ever been familiar with it. Like I mentioned before, libraries have always been an important community resource, but the National Library of Medicine has had a long history of assisting public health officials. They've helped with responses to the 2014-2015 Ebola outbreak. They assisted with recovery during Hurricane Sandy, the Gulf of Mexico oil spill, and the Japanese radiation events by providing timely evidence-based information. Much like Medline Plus, they have topic pages that you can see here, and it's kind of cut off on the right here, but you can see that there are special topics. If you're looking for sort of audience-specific information, you can kind of make out in here in this menu that there are links for children's in disasters, pregnant women, handling animals, and then this page that we see right here, if we were to scroll down, you would get links, and these are custom-built links into DisasterLink and PubMed. So if you click on more, it would show you a tailored, it would show you the results from a tailored search of DisasterLit or PubMed by topic and category, right? So if you're looking for just general information on coping with disasters, that's what that more link would take you to for DisasterLit. If you're an emergency responder or a healthcare worker or journalist or volunteer, then there are custom searches that have been built in DisasterLit and PubMed if you're to look a little bit there. So this is DIMRIC. It has a lot of great information. I won't go into all of it here. Another resource that comes out of the National Library of Medicine is DailyMed. So this is a site of drug listings that have been submitted to the FDA. I like to talk about DailyMed a little bit in terms of disasters because especially with older adults who might have one or more chronic diseases, although many people these days are on some sort of medication. If you lose your drug label or want to just find out more about the properties of this drug or instructions on taking them, DailyMed is a great resource. like all National Library of Medicine websites, they're really good at linking to lots of different resources and linking to each other, as well as linking to other NIH resources. PubMed is another resource I really like. This one is really popular that I found among emergency responders. You know, someone is answering a 911 call and has overdosed. They find pills are unmarked or they're in a baggie. I'm pretty sure 90% of my friends keep some set of drugs in a little baggie, like in their backpack or purse. Maybe not the greatest practice, but if you ever find yourself with an unknown drug or the imprint is worn out, Pillbox comes as a desktop application. It's also web-friendly. I believe there's also an app for Pillbox, and you can identify or search for a pill depending on what its properties are. You can do a physical description of what it looks like. You can put what the imprint is, what the color is. You can do it by ingredients. You can see it here. I like to play with this every so often. And this also a couple years ago got a real nice update to it. You can see in the top right-hand corner what the old one looked like, but I digress. WISER, the Wireless Information System for Emergency Responders. I find that lots of people, especially emergency responders, when I go to disaster management conferences, are already very familiar with this. They might not necessarily know that the National Library of Medicine has come up for it, but whenever I go to any sort of disaster meeting or emergency preparedness meeting, what I hear all the time is they really want to be able to cross-reference different information sources, and that's exactly what, in part, what WISER does. It's a desktop-friendly application. It's also a mobile application that assists with the identification of and response to hazmat incidents involving chemical, biological, or radiological agents. It's designed to help emergency responders, as you might have guessed from hazmat and hazardous material incidents, and it provides a lot of information on different substances, including IDing what the substance might be, physical characteristics, human health information, containment and suppression advice, including what sort of protective equipment guidance you might want. If you look in the top right-hand corner here, you can see something that says current profile, and right now it says preparedness planner. But if you click on that drop-down menu, it will let you choose a different role. So this is also one that one that's good to play around with. It has protective distance estimates and maps, and like I said, it has role-specific information. So some of those other roles, you know, you might be a first responder, you might be a hazmat specialist, or EMS, or a provider. I like to show this. So WISER contains sort of a couple of other resources, including CHEM, and CHEM stands for Chemical Hazards Emergency Medical Management. And again, it's about planning for, responding to, recovering from, and mitigating the effects of mass casualty incidents involving chemicals. And some parts of CHEM have been incorporated into the WISER app. So you can kind of see sort of a symptom checker that's built into CHEM. And actually, you don't even need to be connected to the internet on your phone when you download it. You'll have access to a lot of this information. So CHEM, which is part of WISER, contains chemical identification tools, pre-hospital and hospital medical management guidance for chemical exposure, has decontamination procedures, and really useful checklists of on-site activities providing triage and treatment. I like to show toxidrones. It's a portmanteau of toxic syndromes. And so that's what this screenshot is sort of showing, what are sort of the constellation of effects that some substance has or that you're noticing. And so, like it says here, it's sort of a set of, it's a clinical fingerprint for a group of toxic chemicals. Some of you may already be familiar with ToxNet. Unfortunately, ToxNet was retired, and so really I'm just pointing you to NLM Technical Bulletin. If you're not already subscribed to this or you've never seen it before, it gives you product updates on a lot of NLM, products. So if you're looking for information that previously used to be on ToxNet, this is just a screenshot of part of the list. But this sort of latest issue that just came out last year does show sort of the database that was part of ToxNet and the new link of where you can find that data. Other things that are now currently offered. DIMRIC has a set of, well, through DIMRIC you can get to the you can find that information on classes and getting your MLA, Disaster Information Specialist certificate. And one new class that just came out, I say recently, probably over the last year or so, is Social Media Analysis During Disasters. So with some outbreaks that have come out over the last 10 years, the first place they appeared were on listservs or social media, or you might be familiar with the fact that people were trying to predict the outbreak of a flu based on people just searching for flu symptoms online or flu treatments online. There's been a more formal class that's been put together, and if you go back to that previous site, Disaster Information Management Research Center, you can find information on this class and more, and all of these are freely available as well. So we're almost approaching sort of the end of this hour. Just a few more things. This is my dog. I like to show my dog because for me, as someone who's involved in emergency management and as someone who wants to be prepared, I think about my pet. And so I actually always keep a go bag for Suma that I know to reach for when if I ever need to take off for some reason. It has her food, it has her medication, it has a couple toys. These are some U.S. National Guardsmen rescuing dogs during FEMA. Oh, sorry, not during FEMA. During Hurricane Harvey. And I'm just going to point you real quick. There are lots of resources out there, but FEMA does have a facilitator guide and other different resources for thinking about your pets and service animals. You know, I think most organizations recognize that pets and animals are part of our family, and also important to think about during any given disaster event. South Central region, one of our initiatives, regional initiatives coming up is One Health. You know, so thinking about humans and animals and sort of the larger ecosystem. But I won't get into that. I could. And then the last thing one of the last things I guess I want to direct you toward is our listserv. It's Disaster Outreach Lib. You can see this link at the bottom. I just threw in this slide this morning because I saw it hit my inbox. But if you're interested in disaster information management resources, or you're just interested in being able to respond a little bit more real time with information within your organizations or to the clients you work with, this is a great listserv. After any sort of incident that happens, they always release very specific resources. So you don't need to go digging through Medline Plus or PubMed or DisasterLit yourself necessarily. but you'll always get some sort of email that looks like this that is linked out to specific pages, resources, citations, guides that have been recently put together. You'll see links here from other databases I didn't cover, like GenBank, or I see that there's a mesh record here too. So I really encourage subscription to this if you just want to get really targeted information. Again, NLM has had a long history of partnering with emergency responders because they're able to put out information like this quickly that allows people to either prepare or respond to disasters. Anyways, thanks again for attending. For more information or a copy of these slides, you can go ahead and contact me at that link